This is a retinal vein occlusion by OCT characteristics. How do I know? Well, that's a good question. If you recall the pathophysiology of a retinal vein occlusion, you will remember that the venous obstruction causes a relative delay in arterial filling due to the closed-loop nature of the eye. You can see an illustration of this closed-loop concept by understanding the arterial inflow of blood that moves into the capillary tree that eventually runs out through the veins. More specifically, you can see that all of the blood vessels are connected. So, if you have a retinal vein occlusion and the blood is delayed leaving the eye, then there is an increased pressure on the vascular tree that will result in a secondary delay of arterial circulation. The result is a mild extent of inner retinal opacification on the OCT image as seen here. When you combine inner retinal opacification with intraretinal fluid in a diffuse manner located in the outer retina, you can be pretty certain this represents a retinal vein occlusion. Therefore, you should be able to distinguish macular edema secondary to a retinal vein occlusion from macular edema due to diabetes, where you see intraretinal fluid in a speckled configuration. This distinction should be relatively simple to make in most cases simply by OCT testing. Certainly there can be overlap, and clinical examination plus ancillary imaging is important, but an understanding of subtle OCT differentiations can make all the diagnostic difference. Got it? Good. Now practice distinguishing diabetic macular edema from retinal vein occlusion with our training program at eyecarepd.com.